Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, and now I am doing the dental practice brokerage for 16 years. So it's very exciting. Today's topic is what are the retired dentists doing post-closing of their dental practice? We'll give you a summary. Before we get into that, as you know, we are now in 25 states. We have 10 employees, and we're working 363 days a year. We take off Christmas and Easter. So give us a call. I'd be more than happy to chat with you. Our phone number is 201-663-0935. And our websites are dentalpracticeguide.com or dental practice or nationwide dentalpracticebrokers.com. So call us. Everything you're about to hear is for informational purposes only. It is not legal or business advice. All right? If some of you have the larger practices, over $1 million, you may want to think about selling to one of the DSOs. And that's corporate dentistry. Now, some have had some problems recently. Certainly, you have to be aware. We're pretty much aware of who has trouble, whatever. And we can guide you accordingly. They will often pay our commission. So give us a call. We can chat with you about that. And remember, if you have a very large practice, over $1 million of a sale price, it closes upon successful closing over $1 million. We will, or $1 million and more, we'll reimburse your legal fees at closing. We've done that multiple times. We have 3 coming up right now. We're reimbursing everybody's legal fees. Anyway, so as we move along, what are these retired dentists that have sold their dental practice? What are they doing? Are they happy? As in overall, I have, after 16 years, I've rarely, if I can even remember one, I don't even know if there is one, but if I can remember one, I don't recall anybody calling and say, I wish I did not sell my dental practice, or I should have never sold my dental practice. I have no history on that. I don't recall anybody saying that. Excuse me, we got a beautiful day in Jersey. I'm down the Jersey Shore, and the sun is brilliant. I need some glasses. Excuse the glasses. Anyway, hey, maybe it'll make me look younger anyway. This is my hair, by the way. It's my hair. I don't have fake hair. I hope it stays like that for a long time. Maybe because I'm happy. I don't know. I'm having a good time doing what I'm doing. Plus, now that we have people we sold to 16 years ago, 14 years ago, those buyers are now becoming sellers. It's like, how can I ever retire? Forget it. No way. Just keep going at it. Anyway, I don't remember anybody. I don't recall anybody that called me and complained and said I should have never sold my dental practice. I have no recall on that. Majority, I'll give you one case in point. Sold his practice. He was from a larger city, I believe, and good guy, gal, whatever. He said to me, I think I like to quote, I don't have enough time to do everything I want to do. A big golfer she is, and she golfs like, I think 3 or 4 times a week, lives near a golf course, and then racquetball. Heavy racquetball. That's 3 times a week tennis, maybe once or twice a week racquetball. I love it. And she's in, good physical shape. So it's something to think about. That the opportunities out there are just fantastic opportunities right now. To get out, and opportunities for you to build another business, work for somebody else. There's just so many. That's what I did. I retired 20 years ago, but I was bored. I'm not going to stay home. Anyway, getting back to it now. This one doctor couldn't be happier. Having a great time. Heavily involved with sports and activity. Stays in warm weather client in the summertime, winter time. And just having a lot of fun down there. I mean, just enjoying themselves. Another doctor was in subspecialty in dentistry. Had a very good reputation, would lecture around the world. And what they're going to do is continue their working post-closing for a little while for the doctor. But then they're going to do their lecturing around the country. They're excited about that. Or may do in-house training of what their dental specialty training is. They may do that. On the other hand, they said to me the other day, I don't even know if I want to do it any more dentistry at all or teach anymore. I just may relax more. Hey, which is fine, Another doctor said to me, well, I like golf, but how much golf can you play? You get tired of it after a while. He continued to work for about 4 years for the buyer, and it worked out fairly well. Fairly well. It's never perfect because it's not your deal anymore, And you're an employee, you don't have the write-offs and so forth. So he's like part still working and part retiring, which may be best for him. But each one had a specific time. And a lot of them, especially now, got out because they're tired. This PPO dentistry is wearing everybody down with the low fees. It's just not working out well. And some of those DSOs are having trouble, maybe more than you know, are having trouble. So we'd like to stick with the better ones that we're going to recommend. All right? But as of right now, these doctors are relatively happy. All right? I don't suggest do nothing. I do suggest you get out there, have some income. You may not know how long you're going to live anyway, so you might as well make a few extra bucks. And if you have free time. I mean, you're a skilled individual. There has to be something you want to do. I personally liked being in business. The dental practice sales. I enjoy that. Overhead low. You don't need bricks and mortar. It just works out well, and everybody's happy at the end. Happy buyer, happy seller. That works out real well. And you're dealing with a nice clientele. These are all professionals, So, you're not on like doing a retail low fee reimbursement type thing. You're not stuck with bricks and mortar. You're not stuck with inventory. You want to get away from that. No inventory, no bricks and mortar. More like being a sales rep, so to speak, that type of thing, where you don't have any stock that you have to keep. Or also to be out there dealing with people, I think is important. Interacting is important. I feel you have to do something. Being a couch potato, I think, will be contraindicated for you. I don't suggest doing that at all. Being a couch potato, doing nothing. It's just not going to work out. But you can do that, When do you retire? I am telling you, retire before you're ready. Many of your accountants will tell you not to retire. Often that's what they say. But I'm saying if you have somewhat of your savings close to your financial goals, somewhat at least, getting maybe 75-80%, my opinion is get out, cash out of the practice, get top dollar now, because the overriding factor is you could get disabled. You get disabled, your practice value is going to plummet like a rock. It will plummet. So you don't want to get into that. You want to avoid that. But keep working is my suggestion in some field. It may be a new field a skill set you had. It could be something in the arts. It could be something in business. It could be something in teaching career. There's a lot you could do, but you got to apply. Most of it, what you could do is you're probably not going to learn about it until you get out and you try to start, you're exploring. Your mind opens up. Your mind has to open up. But if you love dentistry, which I hear all the time, we love dentistry so much we don't want to retire. I say, wait a minute now. Why don't you retire and work for somebody else, or work for the seller, or work for the buyer? Why don't you do that? I think you'd be much better off with something like that. Work for the buyer for a couple of years. You guys get along well. If the practice is big enough, if you love dentistry that much. I miss the patients. I don't miss the work. I never hated it. And anything I hate, I just get an associate, like to do endo, oral surgery, perio. Bring an associate to do that, or refer out. But that's why I enjoyed it. Maybe that's why I still have my hair. I don't know. I met a guy once that he tried to do dental practice brokerage. He's got to deal with a lot of chaos. I make it sound easy, but I work all the time. He said he tried it for 6 months and lost all his hair. I don't think he had much of a backbone. But getting back to it, so every dentist that's sold is relatively happy. Nobody's complaining. Travel. Now, a lot of doctors are way behind in their travel, and it's the spouse pushing for it. Spouse says, we've got to get this together. They want to do catch up in life, and a lot of them, it's going to be travel. I particularly like cruise ships. It's whatever meets your fancy. But cruise ship is nice because you're on the same boat. You can in and on, in and off, back and forth, back and forth. I just get back from Taiwan and Vietnam and Tokyo, Hong Kong, that whole strip over there. 2 weeks on the cruise ship, 19 days away. And I wanted to get back to work. But my team handled it well. So I think that you will not have a problem, and it doesn't matter what you do. There's so many options open to you. You've got to explore. You can start exploring some of these options now. This is what I suggest. Explore them now before you retire, so you get a pulse of it. But you really probably won't know what you want to do until you finally retire. Then the world will open up. Remember, open up a small business. Do consulting. Do small sales. Do something. Stay busy. All right, team, we're having a great time over here. We got a beautiful New Jersey day, and hope you're having as much fun as I am. Talk to you. Bye now.